This new technology allowed us to take an individual's own white blood cells, take them out of the body, genetically engineer them to target tumors specifically, and then reintroduce them to attack the cancer. Today, 14 years later, there are still patients who remain progression-free and in remission since they started some of those trials.
Welcome to the Super Clinic Project Podcast, where we take regular clinic owners and turn them into cash-based multimillionaire entrepreneurs. Warning, if you're a doctor who listens to this podcast regularly, you will make millions of dollars. Do not listen to this podcast unless you want to be a successful clinic owner who helps thousands of patients achieve their health goals and adds more money than you can imagine to your bank account. You've been warned.
Welcome to the Super Clinic Project Podcast, where we take regular clinic owners and turn them into super clinic owners. My name is Jennifer Gligoric. I'm your host today, and we're going to be here with our guest who started out getting his degree in biochemistry. Then he went on to get his MBA, taking him down a career path in biotechnology for over 24 years. He's done everything from operational analysis, investment banking, to his current role, co-founding and serving as the president, CEO, and director of Innate Bio. So please let us welcome Dr. William Ho to the show. Welcome.
Hi, Jennifer. Thanks for having me today.
Well, I'm excited to have you because you have such a fascinating background. It's hard to see people who are biochemists who then go into funds and investments and then back around the way you have. What inspired you on this journey? Tell us a little bit how you got here.
I guess not all of it was by choice. I think early on, I was working in a lab and decided that I hated working in a lab and that I wanted to go do something else. So I started taking some classes in the business school and eventually went to business school, got an MBA, and then started my career in investment banking at an investment bank called Cowen in their healthcare investment banking arm, doing both corporate finance as well as M&A.
Wow, that's quite a journey to be able to do that. What did you think was the biggest transition from going to research, which you said you hated, into something completely different? Because those are two totally different mindsets.
I think for me, going on, when you do your MBA, you go through the normal cycle and everybody's trying to land an internship. And quite frankly, when I started, I didn't know anything about finance. Reality is I didn't even know what an investment banker was. I had never heard of one. But I realized that I could actually bridge the two sides of my career in that I could bridge science and business into one career. Now I've spent 24 years in biotechnology. Many of those years, about 17 on Wall Street, across all aspects of Wall Street, as you mentioned, from investment banking. I was Bank of America's lead biotech analyst, as well as on the VC and the public investing side. And again, not all of that was by choice. I started in 2001 in healthcare investment banking. As many people know, unfortunately, in late 2001, 9/11 happened in New York City. Wall Street dried up, and I unfortunately was laid off. Rebuilt my career, was the lead biotech analyst at Bank of America. And then the financial crisis hit. As the CEO at that point said, we didn't have any exposure to mortgages, but Bank of America seemed at that point to have acquired their exposure to the mortgages at the very peak of the market, and found myself having to rebuild my career again.
Goodness gracious. Tell us a little bit about that in the rebuilding. What do you think helped you make the pivot that you had to make? So, we mostly have clinic owners, and many of them either have already made their pivot, or maybe they're even thinking now to pivot because of all the changes that are happening. What do you think helped you the most in doing that? Because you did it very successfully.
I'll tell you, at the time, I wasn't sure it was going to be successful. I think it really is true that you never know exactly how your career or how a project is going to unfold until it's in the rearview mirror. Everybody looks at my career. I was at one of the leading healthcare venture capital funds, was very successful on the investment side. And today I founded and the leader of this company. But back then, it was quite frankly quite scary. As you mentioned, a lot of your listeners are trying to figure out, do they build clinics? How do you build it? What do you do? Starting a business is always fraught with risks and fear and uncertainties. And you ask yourself, can I do it? What I did was there's no path except to go forward. There were periods where you didn't know if you're going to make it. I spent my career, I did everything I could, got into this career in investment banking that I thought was this hot career, only to get laid off. And at the point when I was laid off, I thought, oh, there it goes. Everything I did, it's all gone. That's the end of my career. But it's only in the rearview mirror that you can see all these points in your career and what you've learned throughout those points and how they'll help you through your journey.
I think that that's happened a lot through the lockdowns. I mean, it was overnight for everyone. And they were all like, well, now what? What do we do? Well, now what?
Terrifying for us. I mean, I'll tell a story. February of 2028, we closed an extension on our Series A and raised.
Wait, you said 28.
Sorry, February of 2020. February 28th of 2020.
Okay.
We closed an extension of our Series A financing for our company. As you know, that was about 2 weeks before the COVID lockdowns. Before I had closed that additional financing, I only had 3 weeks of cash. I could make one more payroll. And we had just launched the clinical trial. We raised the money. Everyone went into lockdown. And then, as you know, all the hospitals got slammed. We had clinical trials that were just getting up and running. The hospitals were shutting down. We had clinical sites that ran out of PP&E. And so we had to find ways to source gowns, gloves, N95s, etc. I was on the corner of New York City trying to find a supplier for N95s.
My goodness. Oh, yeah. I remember all that. Well, it did teach us a lot about our supply chain and the things that we needed to do. I mean, from our end, it was like, do people really need this much toilet paper? Why is everybody going nuts with this? Like, who would have thought paper towels and toilet paper would have been the thing that they became?
Yes.
It's like we have a lot of gut issues in America because of stress or whatever it was. Yeah, that's interesting to have to go through that. But you made it through it, and now you're working in a just incredible career. So let's talk about from what you've seen and now moving forward out of that. Tell me a little bit about what you're doing now, and then let's talk about it in terms of what people are going to be looking at here in the future.
Yeah. I founded a company. Our company is called Innate Bio. We are a cell therapy company. I was in the venture capital world in 2014 when a technology called chimeric antigen receptor T cell, or CAR T, came out of the University of Pennsylvania and Memorial Sloan Kettering Cancer Center in New York City. This new technology allowed us to take an individual's own white blood cells, take them out of the body, genetically engineer them to target tumors specifically, and then reintroduce them to attack the cancer. Today, 14 years later, there are still patients who remain progression-free and in remission since they started some of those trials. But in 2014, I was trying to figure out, how do you take that technology from the blood cancers like leukemias and lymphomas into the solid tumors? It's a market that was 9 times bigger. The tumors such as lung cancer, ovarian cancer, liver cancer, and brain cancer. And how do you ultimately develop a therapy for those tumors? And it's been a challenging path, but today we're very excited about the data we've reported. We have one of our lead programs is in glioblastoma. It is a devastating disease with a 5-year survival rate of about 5%. Most of the patients will progress by about 6 to 7 months. Most of the patients, the median survival is only about 14 to 15 months. And so it's a devastating disease. And unfortunately, the standard of care has not changed in 20 years. And so we're developing a unique therapy. Very recently, about a month ago, we had a presentation at the American Society of Clinical Oncology. It's the largest cancer conference in the world. Every first week of June, 30 to 40,000 clinicians and investigators and operators descend on Chicago, where we present our most recent and updated data. And we had an oral presentation this year at the ASCO conference that we're quite proud of.
Well, that's amazing. And so, for people that are clinics or have, people who are in this space, wanting to be innovators, wanting to know this, how do we get this more out to the public? Like, how can what you're doing help other clinic owners or people innovate themselves, move into this, or get this information out there? Because just because you can do it and it's working well doesn't mean people would have access to it even soon, even though it's there. I'm always amazed on the show, bringing on people and going, I didn't even know that was available, but yet there's some clinic that's doing it and getting unbelievable results. With it.
Look, we're still in the development phase. The
Mhm.
development phase of any new drugs goes through 3 phases: a phase 1, of generally a phase 2, and a phase 3. There are accelerated paths that allow products to come to market earlier. Our goal is to package all of the material and all the data that we've put together thus far, try to get it peer reviewed and published into a journal later this year, and go back to the FDA and ask what's the pathway forward. As you know, with the new administration, we have a new commissioner of the FDA, Makari, as well as the head of the biologics division, Vinay Prasad. And they're doing a lot of communication with the public and with companies. They have done numerous YouTube podcasts, webcasts, and roundtables. And we're hoping, given the devastating nature of this disease, that we can go back to the FDA and ask for what's the pathway forward. In the meantime, just spreading the word that there are innovative therapies on the horizon and to drive interest, because we really do need continued support. These patients, unfortunately, are dying. These therapies need to come to the market as long as they're safe and not harming the patients anymore.
Yeah, okay. That answers my question for that. So let's go back to the business side of it now, because that's interesting. For the people, we're talking to Dr. William Ho. All of his information is going to be on superclinicproject.com if you want to find out more. If you're in a space following this, or you know someone who might be suffering from what they fix, all the information will be there for you as well. And then at the end, we'll have Dr. Ho give you the information. But going back to biotech, I remember hearing you talk about biotech being at a crossroads and talking about 3 major things: investing, innovation, and leadership. Tell me a little bit more about that.
Biotech is in the most difficult place that we've been as an industry since probably the early 1990s. Unfortunately, many people in the early 1990s who were around are either retired, or many have unfortunately already passed. In the early 1990s, the biotechnology industry was at its nascent early beginnings. Today, we're almost heading towards 5 years of a downturn, and many companies are suffering in that the capital environment. Many companies have not been able to raise the capital in order to allow them to continue to execute on their science. I think it's been a tough time. It's not just on the company and the technology side. Obviously, with some of the changes, there's been stress in the academia and the research side, but also on the investors. In the environment that we've been in, where interest rates have remained high for a number of years, it's difficult for capital or cash-consuming industries like biotech. But biotech is strategic for our country. We are the global leader in the development of novel new therapies that can really change healthcare for patients. Many of the treatments that help many patients suffering from diseases like cancer or autoimmune disease, or even some of the rare diseases, the vast majority of those are developed right here in the United States. And we think we have to continue to innovate and continue to push new programs and new products forward so that we continue to be a leader globally in the development of new drugs.
For anyone who's kind of in this space, do you have any advice for them on ways you found that they can help promote and push forward their initiatives?
I think we're in a unique area. The landscape is changing. There are new individuals where people like yourself in the media, podcasts are coming out for our own company as we do marketing. The traditional approaches of Wall Street that we did 20 years ago no longer work. We now communicate through every channel that we can, whether it's traditional media, but also through podcasts, through Twitter and X and TikTok and Instagram and all the different channels. If you look at our company, Innate Bio, you'll know we put out short form videos as well to try to educate people of what we're doing. Last month for Brain Tumor Awareness Month, we put out a video with one of the patients that we treated. And so really getting out there and using all the different tools and avenues that are at our fingertips in order to educate people.
Yeah, we work with a lot of in our clinics, and of course we have ads, we have a big marketing program and all of that. But I'm going to tell you that testimonials and anything person-centered, even just taking selfie style videos where it's just more authentic and one-on-one, less polished, those are doing really well in all marketing tests. People really want to have more human connections with what they're doing and the stories that are getting out there. And the more relatable, humanistic, good testimonials you can get, those are very quick ways that you can garner the public's attention to whatever you want to have done. So I highly agree with what William is talking about here. Do you think that companies like, I think when I think of biotech, and maybe I'm wrong, maybe it was not biotech so much as just, I don't know, in the medical technology sphere, but companies like Theranos, when you have that horrific scandal of it, and do you think that messed up investors with that, because so many big time investors got roped up in what ended up just being ridiculous?
I mean, Theranos was a unique story, right?
Yeah, it was crazy.
That was a huge fraud that lost a lot of money.
Billions.
There was one investor in the Texas area that I probably saved a couple $100 million. I was an investor at that point. Early in my career, I spent a lot of time doing diagnostics. I spent part of my research analyst years doing life science tools and diagnostics. And I remember they came to me and said, what do you think about this company that can do all these tests in a drop of blood? And I never understood it. Quite often I found in biotech, if it's too good to be true, often it is. And so, in biotech also, when you have boards and operators that have no background in biotechnology, no experience in biotechnology, that's often a big flag.
Oh, yeah, yeah. I just remember I was watching about the female leader of it, and I forget her name right now, but her persona she adopted, talking in this very weird low voice, and then she only wore turtlenecks, right? Like, it was just, I thought, how can you be that bizarre and then get people like Kissinger to give you all this money? I mean, that's why it's so crazy. You're like, you can, you're in world wars and all this stuff like that, but then some very weird person.
Obviously, she adopted a complete persona, because today with the press and the media that comes out now that she's in, Elizabeth Holmes is in prison, seems to be very different. I think, look, investing is tough. Even on the professional side, I think a lot of people don't have the time or don't have the knowledge or know-how of how to do actual diligence. And many people use heuristics. We take shortcuts, right? Association with the right people. As one of my board members said, influencers, one of my board members says, look, sometimes you can't help it. People just want to buy Louis Vuitton. And it's just the brand.
Yeah.
right? And
It
so
is.
having someone like Kissinger is your equivalent of Louis Vuitton. It's
Yeah.
the right association. And
Yeah.
people use heuristics and those shortcuts to make their decisions.
As far as you know, you have to still always do your due diligence. So, because some of the biggest frauds in history were frauded upon some very, very smart people. When you think about who is the other guy that was going after people? The famous actress Anne Hathaway. She was dating a guy and he defrauded like cardinals and the Pope and all these famous European people and stuff. And they were all savvy people, right? But it's amazing how even savvy people get it. You can still, the average person can still go, wait, that doesn't make sense. Go with your gut. Right. And
yeah, I tend to trust
research.
my intuition. Your intuition is your experience over time trying to tell you something that you may not consciously recognize with your brain. I think I've often found in my experience, it's kind of funny going back to my investment 20 years ago on the investment side, a lot of the fund managers and the investors, they would hire FBI interrogators or CIA interrogators to teach yourself how to read body language.
Are you kidding me? I read Chris Voss for the same reason. It's fascinating.
It's actually funny. I was actually rereading Chris Voss's book.
Yeah, I have it
today on the flight here. I'm down in our Birmingham office.
Yes, it's a good one. It is.
An
never
awesome
split
book.
The difference.
Yeah,
never split the difference.
Love that book.
It is. It makes a lot of sense when you're talking to people, but also too in the sales context. If you want to be a professional salesperson, and you're at the top level, right? And so your main goal isn't to make a sale. Your main goal is to say, do you have a unique problem I am uniquely positioned to solve, and is it solvable? Well, then we need, and will it be a win-win-win? If so, it's your responsibility to get that person to that end goal, right? To get them through whatever limiting beliefs they are, or whatever, if it's going to be a win-win-win, right? And so when you put it in that context, being able to understand those markers is really, really it's fascinating, but it's very powerful too. Even just a couple of them, a couple of tips from that.
For your listeners, if you're running clinics and you're trying to solve solutions to Chris Voss in his book, one of your main jobs isn't just to negotiate, but is to get to the black swan, to ask the questions and ask how, and to understand the key drivers to the person on the other side, and understand what are the black swans that you can use to help you to help them.
Yeah, absolutely. Your sales process shouldn't be you talking. It should be you asking questions to figure out, why now? Like why, yes, you might have back pain. We work with a lot of chiropractors, chiropractic or decompression offices. Why now? What was your motivator to come in now? Where has it been in your life now that's so limiting you that that you need to make a change? Why is that important for you? And not to answer the question for them, because, you'll say, well, it's important because he can't move and he wants to move more. He wants to do this, but you have to ask them that, and they have to tell you what it is, because you'll be surprised at the things that are important to people and what they do. I remember in one person that I was speaking when I was going physically into clinics, and it was all about a wedding. That's why it was now. She had to get something done. I was at a pain management doctor doing incredible work with stem cells. This was back in 2012. And I'll never forget this patient, and why should we consider something outside of insurance and save up for it? Because, and I use this when I'm working with clients now, it came out, weddings were big in their family. She couldn't wear heels anymore. And she thought about those pictures, and she thought about wanting to be there to support her son and what a big deal those events are. And she knew she was going to have to sit or even rest and miss out on everything. And she was really didn't realize she had gotten to that point until her son said, we're getting married. We're going to have the wedding here. We're going to want this. And all of a sudden she realized, what if I can't do it? And all of a sudden she had radical honesty and acceptance in her head and went, I've let myself go too long that now I won't ever be able to do that unless I do something. And she just wanted to find the place that could get her to the other end. And thankfully we worked at a place that did get her to the other edge. And she wore these little kitten heels and she was so happy. And we got all the pictures and all the stuff when it happened. But yeah. And if you don't ask, you wouldn't know that. And if we wouldn't have been able to communicate with her the journey that was going to happen and then the end result, the what's in it for her in a way, in what she really wanted, she probably would have walked out, and been unhappy and went, that's another person who let me down. And that major life thing would not have happened, for her. So you're absolutely right. So what else besides, the FDA and the things that you're doing in the business part of what you're doing as CEO, what are the big things that you're looking forward to in the next year to work on in the business?
I think we're an exciting time for new therapies and innovative therapies. I personally am very excited and hopeful that the new administration and the new members of the FDA will recognize the technology and the excitement of the science that's being generated right here in the United States, and that eventually that the investors will take a hold of that, because there's this lag. There was so much uncertainty with the new administration, and investors were so bearish and so negative. But for me, it was to try to listen. Just going back to what we were just talking about, whether it's clinics or patients or business, much of it is shut up and listen, and try to take your own biases outside of that and understand where the other party's coming from or what they're trying to accomplish. And so for me, I've been quite positive about this FDA, and I think investors are just starting to get there. We're excited. We have a couple of novel new therapies that are in development. As I said, our goal is to go back to the FDA and try to figure out, is there a path forward towards registration or towards an accelerated approval? We have a unique T-cell engager therapy that we unveiled in the spring. We hope to have additional data later this fall. As well, we're hoping that the financing environment for biotechnology broadly and for ourselves improves so that we can continue or reaccelerate our growth.
I hope so too. I would like to see us become a superpower in healthcare instead of the broken systems that we have. If we keep pushing forward, especially in the private sector, and we keep engaging new and new clinic owners, new and new businesses, if people take the chance to work on their dream and work on this research and just push forward and use media and podcasts, which are the incredible public forum, because you really can hear what's really going on in a completely free way, which we are getting more and more of now, that it can really be transformative for us as people in the country. So guys, we've been listening to Dr. William Ho. Dr. William, let people know how they can get in touch with you.
Yeah, sure. Our website is www.innatebio.com. You can always email us on our website. We have an investor email. It's info@innatebio.com or ir@innatebio.com. And I often respond to those emails directly.
And Innate Bio is IN8BIO. But also, guys, you can go to superclinicproject.com. If you go there and you click on we just have a couple links. We make it really easy for you. And you can click on our free school and you can get all the information. We also put a lot of fun things that go with our every episode, downloads, worksheets, sometimes quizzes. And you can get all that information there. Be sure, though, to like, follow, and share, and give us a 5-star review. Those 5-star reviews are help us get world-class leaders in their industry, like Dr. Ho here, to where we can hear what's going on, and also to inspire us in what we're doing in our day. Thank you again, William, for being here and for sharing your journey and what's going on in biotech with us today.
Thank you.
You've been listening to the Super Clinic Project podcast. If you like what you hear, subscribe and stay tuned for further episodes of the Super Clinic Project podcast.